Lift up the First Ladies for Health because we have special guests with us. Sister Ebony Washington and Dr. Bob Frank is here. And Dr. Frank is going to come and share with us some important information about this upcoming flu season. I don't know if we're already in flu season or flu season is coming up very soon, but Dr. Frank, would you please come and join the pulpit and share with us, please?
So thank you very much for having me today. Before I start, what I want to do is go back 4 years. Because 4 years ago, Reverend Lynch's father asked me to come to the New Jerusalem Church and tell people about COVID. That's when COVID was ravaging the community, was ravaging the country, was ravaging the world. And we were doing clinical trials about vaccines to see if the COVID vaccine would work. And I came to the congregation and said, we really need your help. And Reverend Lynch helped us. He explained how important it was to get a clinical trial done and then vaccines. And the thing is the vaccines worked. And a lot of it was because of the help that your community provided. That we saved hundreds of thousands of lives because of the effects that you did. And I can't thank you enough. And one of the things that stuck with me is that Reverend Lynch said, don't forget us. We're going to support you, but don't forget us. And I think, hopefully Ebony can attest to this, is that Cincinnati Children's did not forget you. That we brought vans out to the community, that we made sure that everyone that wanted to have a vaccine could get a vaccine, and we kept the community healthy. And because now today, 4 years ago, there was a seat here that was full, a seat here that was full, but it was basically an empty church. And that's not the way it is today, and that's because of how successful the vaccines were, and it's because of how successful your efforts were to help with that. And what vaccines do is they keep us healthy. They keep us so that we can come back to church, we can see the service, we can do all the fine work that you're doing. And one of the vaccines, COVID is still not gone. It's certainly not killing as many people as it did before, but it's not gone. And we do have an updated vaccine that I've just got mine. And so people ask me, you getting yours? Yes, I did, and all my family. But we also have flu vaccine, and that's just as important because every year flu kills thousands and thousands of people that we can keep alive. Now, one of the things a lot of times people say, well, I got the flu shot and I still got the flu. You know what? That may be true. But you're not in the hospital and you're not dying from it. And so that's what we're trying to do. We're trying to keep you healthy. Sometimes you still may get a little bit of aches and pains. You may still feel a little bit crummy. But the difference between unvaccinated and vaccinated people, there's no comparison as far as when you get the illness. And so that's what I just really urge everybody to come get vaccinated. It's important. Get your blood pressure checked. Get your mammograms. Get your prostate exam. Get all the preventive kind of things that you need to do because we want to keep you healthy. And so what I would just say in closing as far as that we have the flu vaccine, we have the COVID vaccine, and I'm a pediatrician, so our vaccines always have really been focused more on kids, but now we have a lot more vaccines for adults too. If you haven't gotten your shingles vaccine, please go get it because you don't want to get shingles, trust me. There's a RSV vaccine now that's really good, and especially it also helps if you're taking care of the little ones, is that you don't give something to them and they don't give something to you because they're happy to share that stuff with you. And the other one is pneumococcal vaccine. It's an incredibly effective vaccine that will keep you from getting that very severe infection. So thank you again for allowing me to come talk to you today. If there are questions about vaccines, I'm happy to answer for you. But the one thing, I guess maybe in closing, is to think about it this way. Like I said, the pediatrician is to focus on children a little bit more, but this really could be for anyone. 100 years ago, 35% of our deaths were in children under 5 years of age. Of all the deaths in the United States, 35% were in kids under 5 years of age because we didn't have vaccines, because we didn't have antibiotics. And when kids got some of these infections, they died. And now it's less than 1 in 1,000. That is tremendous. And that's what vaccines can do. And it can have those same effects on you as adults to keep you from getting flu, to keep you from getting severe flu, severe COVID, pneumococcus, RSV, shingles. These are life-saving things that I would say that God gave doctors the ability to learn these things, to be able to bring that health to you. Thank you.
Amen. God bless you. I like that. God gave it to the doctors, gave them wisdom, gave them insight, gave them the resources of the earth. Amen. God bless you. God bless you. God bless you. Thank you. Thank you. Thank you.